is Murad Wahba. I'm one of the psychiatrists working on the psilocybin for treatment-resistant depression trial running up in Newcastle. And in this video, I'm going to be talking to you a little bit about our study and a little bit about psilocybin therapy in general in terms of how we use it in practice, how it might work, etc. So our site is one of over 20 sites around the world. There's some sites in the US, some sites in Canada, and all around Europe. And it's the first and biggest trial of its kind. It is looking to recruit over 200 people, and it's looking to find whether psilocybin can work and is safe in people with treatment-resistant depression. Treatment-resistant depression is defined as depression that hasn't responded to 2 or more antidepressants, and this is the same definition that we're using for this trial. It is also a dose-finding study, which means that we are using 3 different doses, and we are trying to find out which dose would be the best dose to be studied going forward. So this is only the first trial, hopefully of many more to come. And it's an important part of studying it in the future is finding out which dose would be a good dose to study. It's no secret really that depression is a devastating illness. I think anybody who's either suffered with depression themselves or knows somebody who suffered with depression, they know that it affects all aspects of a person's life, from their bodily functions, their appetite, sleeping, motivation, relationships with other people, relationship with oneself. It's a really, really devastating illness, and so it's no surprise really that it's the leading cause of disability worldwide. It affects over 320 million people around the world, and 800,000 people die by suicide every year worldwide. Not all of it attributed to depression, but a sizable portion of it will be, because there's a strong correlation between depression and suicide. And unfortunately, the current treatments we have, while they work for a lot of people and they are enough for a lot of people, for others they are not enough, and they don't offer the level of benefit that people expect, or they find them difficult to tolerate, or they don't like taking medication every day. So psilocybin, we're hoping that psilocybin can provide an alternative or another tool in the toolbox to help these people for which antidepressants have not really worked for. So a little bit about psilocybin itself. It is a molecule found in different species of mushrooms, sometimes called magic mushrooms, for their psychoactive effects. It's believed to be the mechanism of action, so how it works basically is believed to be by working on a receptor called 5-HT2A, which is basically a serotonin receptor. So because the molecule looks a little bit like the neurotransmitter serotonin, it can work on the same areas of the brain or similar areas of the brain and creates its psychoactive effects in that way. It was researched in the 1950s and the 1960s, but then research was halted after the drug was rescheduled, and it was researched at the time for addiction, end-of-life anxiety, etc. But the quality of the research studies at the time was not enough to discern whether or not it is a useful drug to use. But over the past 20 years, there's been a rise in interest, and scientists have been studying this around the world to figure out whether it can prove to be a useful tool, and evidence so far is very promising. And our study is looking to add to this body of evidence, hopefully on the pathway to psilocybin being used as a drug in mainstream psychiatry. Compass Pathways is the sponsor for the study, and they are a company that have synthesized the formulation. So they've made psilocybin in the lab, and they're investigating whether it would work in depression, initially hoping to move forward afterwards. When somebody ingests psilocybin or somebody takes psilocybin, they have what is called a psychedelic experience. And for those who don't know, the word psychedelic itself means mind manifesting. And it's an old term that was used to describe the drugs like psilocybin and similar ones when trying to describe what their effects are. It's notoriously quite difficult to describe what the effects are like, because one of the characteristics of the actual experience is that it cannot be described in words, so it's hard to try and put words to it. But generally, what the substance tends to do, or what psilocybin tends to do, is that it causes changes in how people feel, so in their emotions, how they perceive things in terms of visually and auditorily, and through the cognition in terms of how we think and how we experience ourselves. So it really causes quite a significant change, and it's currently not really clear why exactly this happens, but there's a lot of evidence that points towards a difference in how the brain processes information. So a lot of different parts of the brain talk to each other a lot more, whereas other deeper parts of the brain don't talk to each other as much, or the parts that are responsible for assimilating this information into something that is coherent and clear and that we can use in our day-to-day consciousness. This mechanism seems to be disrupted and leaves space for something called unconstrained cognition, which is almost like free-flowing information in the brain. And we're going to be talking about that a little bit more in the mechanisms bit, but this is generally what it's like. So, but it is a really quite a powerful experience for a lot of people, and it is dealt with in the research as such. It is handled very carefully as an experience, and it is used within a long treatment program to ensure that it is best utilized. So the experience is at the heart of the treatment, but it is not the whole of the treatment. The treatment consists of different phases to ensure that the experience is had in a safe and potentially and hopefully useful way. And it consists mainly of 3 different phases. So the first phase is preparation phase. It's no different than somebody going on a trip to the Lake District, for example, where you need to know where you're going, you need to know what to expect, you need to know what the weather might be like, so that you're basically prepared mentally and you have supplies with you to help you along the way. And it's the same thing. You're going into an altered state of consciousness, and people are prepared for this altered state through a series of meetings with a therapist. Here, it's about 3 meetings. And the goal of this is, first of all, to build trust with the therapist. Second of all, to learn different ways of paying attention to one's own internal process, because this is an important part of paying attention to what unfolds during the experience. And there's also access to a platform to remind people of what to expect and how to be ready. So, and another thing also actually is that there's breathing exercises and different grounding techniques that people can use if they find that the experience is difficult in the midst of it. And this all leads to the actual session. So the actual session is people take psilocybin in a room that is built not to be so clinical. So it's built to be more calming. It's with dim lighting and paintings on the wall, and just basically it's made to be a living room, cozy like space, so that people can have this experience in a place that's comfortable. And there's a musical playlist that is specifically made to flow with the effect of the experience on the brain. So if, for example, it takes a little bit of time to start, the music starts off slow, and then it becomes more emotionally provocative as the drug starts to work on the body and on the brain. And people often report a sense of connectedness, emotional breakthrough, and acceptance, which is part of the psychedelic experience. As touched on before, people can sometimes feel that they are connected to a greater whole, or they're connected to themselves more, or they're connected to different aspects of themselves that perhaps they have lost. Emotional breakthrough, which basically means that some people can experience emotions that they have been perhaps they've not been able to experience it. So some people with depression find that they can be quite emotionally numb, or they don't feel much. So they start to have a flux of emotion as a result of the psilocybin, and acceptance of these emotions. And these seem to be really important parts of the actual therapy, in that people are having this psychedelic experience and having all of these emotions and having all of these thoughts, but they are interacting with it in a way that is accepting and observing rather than judging, which is part of the preparation of going up of self-directed inquiry. What's happening with me now? What's arising outside of me now? This curious outlook that helps people understand the material that the brain orchestrates. So I'll speak about that actually a little bit in the next slide as well. And then once they have the the experience, people go home, they go to sleep, and then the next day they come, they speak to the therapist, and they try and make sense of what this experience was, any salient parts of it, and try to talk it through to understand whether there's any um, insights that have been gained, or any learning, any wisdom that's been gained from going through this experience, and how they can use this into their daily life afterwards. So it's really a whole process that is needed, rather than just administering the psilocybin. And this is why it's called psilocybin therapy, because it is within a therapeutic context. So this is kind of what the room looks like. And again, it is designed in this way so that people can feel comfortable. And when they lie on the bed, they put on an eye mask and headphones. So the headphones, they follow the drug as mentioned. And then the eye mask, what it does is that because it cuts out visual sensations, it leaves space for the brain to orchestrate its own experience. So it's almost like a dream, but you are awake. So, and the idea is that the material that can come up, it can either be symbolic, or people can experience memories from childhood that they had long forgotten, or they can sometimes become unstuck from a pattern of thinking that they've been in for a very long time. So there's really a lot of different possibilities of how this therapy might work. But what is seen so far is that the evidence points to this experience being a beneficial experience when used in this way. This is just an outline of the study. So basically, we screen people in the beginning, and then over 3 to 6 weeks, we take them off their antidepressants, just because they're known to attenuate the effect of psychedelics or psilocybin, and this is something that's also being studied further. And then once they're prepared and they build this alliance with the therapist and they're taken off antidepressants, they're administered 1 of 3 doses. So 1 milligram is generally a really low dose. 10 milligrams is a medium dose, and 25 is a high dose. And then they're seen the next day for integration, and then followed up every week for 3 weeks, and then gradually spacing apart until around 12 weeks. And this is the evidence so far. So this is the evidence where that this study is built on. So the first clinical trial started in 2011, where they were looking at things at psilocybin for treatment of end-of-life anxiety. And this only showed a significant difference at around 6 months' time. So what happened was that they recreated this experiment, or this trial, in 2016, both in New York and in Baltimore, Maryland. And what they found was that after 1 experience, people had long lasting therapeutic effects that outlasted the effect of psilocybin on the body. So psilocybin leaves the body in about 24 hours, it's completely gone, and the experience itself lasts 6 to 8 hours. However, for these people who've had this experience, they have had long-lasting effects up to 6 months, and in some aspects up to a year or more. So that was really quite remarkable, in that people who have not had respite, or have not felt better on antidepressants, they have felt better after having the psilocybin for a long period of time. And building on this evidence, in London, there was a trial looking at psilocybin for treatment-resistant depression. So basically, they looked at people who haven't responded to antidepressants for a very long time, and they found that even, I think the median duration was around 18 years of depression. So it's people who have been depressed for a very long time, and they've also found that they responded to 2 doses of psilocybin. This time it was 2 doses in escalating fashion, and they found that, again, effects outlasted psilocybin in the body, and in some cases was up to a year. This was again recreated, but this was not treatment-resistant depression. This was actually just in November, where psilocybin was also found to have this effect. So basically, consistently, psilocybin has been found to have an antidepressant effect that outlasts its effect on the body. In terms of how it works, it's not really very clear, but there are a lot of hypotheses going around. One is that the experience itself plays a role, that being inside this experience, people can gain insights into certain aspects that are contributing to their depression, or people can see the world in a different way. They can be unstuck from patterns of thought that become stuck over a long period of time. And this is what the image above refers to. It's called relaxed belief under psychedelics. It's a hypothesis that was written in 2019, which basically looks at these substances as a method to relax beliefs. So if we think of the brain as a prediction machine, it takes in information, it compares it to a template that it already has of the world, and it gives you a prediction of what the world is like. Sometimes this template can be very rigid, and when it is rigid, it's not really corrected by the information that's coming in. So if you think, for example, somebody who has social anxiety, if they go into a room where perhaps 8 people are smiling and 2 people are frowning, or 8 people are not looking at them and 2 people are looking at them, perhaps the attention will go to the people who are looking at them, because the template says that generally people pay a lot of attention to me when I'm in a room, or not pay a lot of attention. People judge me when I'm in a room. People look at me and they think negative things about me when I'm in a room. And what psychedelics are hypothesized to do is relax these beliefs a little bit, so people can think about things in a different way and think about things in a way that is outside of this frame, and then integrate this afterwards. And then hopefully when they integrate the different insights into their daily life and they make changes to align with this integration, then this can lead to long-term effects. People do relapse, so this could be perhaps the brain going into its grooves, like the ice skater analogy, where the ice skater goes into the same grooves over and over again, and then psilocybin perhaps putting in a layer of fresh ice. But then over time, this can happen, and that people go into their grooves again, which is part of what is also being studied, whether people relapse, when they do, and how this can be helped. And below, there's just some descriptions from different participants, people saying that it was like a light switch being turned on, like a reset switch or a reboot switch that has been pressed so everything could run properly, thoughts could run more freely, perhaps unconstrained by these beliefs, and all these networks could work again. It unlocked certain parts which were restricted before. Also, there was another quote saying that it was a change of state to being stuck in a place of rumination, being able to move out, it reconfigures you somehow. So this really plays into the idea of this unstuckness. Somebody's stuck in a certain state of mind, and the substance is just shaking this up a bit or loosening up this stuckness, and so people can see things in a different way. And then there's also a hypothesis about neuroplasticity. So in the image above, you'll see that these are some neurons that have been treated with different substances. And while psilocybin is not has not been used in this trial specifically, it's a close cousin of dimethyltryptamine, DMT, and also the 5-HT2A receptor on which psilocybin works is also implicated in neurogenesis and can open a window of plasticity, meaning that there may be a window of the brain being more plastic after these substances are taken, after psilocybin is taken, and this may contribute to the long-lasting effects that is seen. There's also a hypothesis around change in blood flow. So they found that some changes in blood flow in the amygdala correlated with improvement. So perhaps this could be part of the process as well. Or it could just be a mixture of everything, which is not unlikely to be the case. But yeah, just a mixture of all of these things. So in terms of safety, psilocybin is a safe drug. So physiologically, it is not associated with any disease of any organ system in the body. There's a theoretical risk of serotonin toxicity. However, this has never been reported in studies and would need a dose that is many times greater than is practically used in clinical practice for it to be a danger. And there's also a risk of aggravating heart disease because it raises the heart rate and blood pressure temporarily. However, again, this has not happened in modern studies, and the patients at risk are usually excluded from the start. So this is something that's taken into consideration in the screening period. This is a study that was done by Professor Nutt, and it interviewed substance misuse experts around the UK and then around Europe, and it concluded that psilocybin was the drug with the lowest harm and the lowest dependence potential of different drugs or street use drugs. So in terms of psychiatric risks, there is some transient anxiety and the transient perceptual disturbances, which are actually part of the actual experience. But for some people who are prone to psychosis, psilocybin can increase the risk of this psychosis manifesting. And while there has been no evidence of prolonged psychotic reactions in modern studies, this is believed to be highly in association with people being screened carefully for psychiatric history and whether they had a history of psychosis or a first-degree family history of psychosis. So this is used quite carefully in this way. And there's something called hallucinogen persistent perception disorder, which some people call flashbacks. And these are very rare, although they do happen. All studies that have looked at these have lacked control for confounding variables. So basically, we didn't know if people were using something else, sometimes we didn't know how much people were using it. But so far, again, in modern studies where people have been well screened and they have been well monitored and well supported throughout the experience, these psychiatric risks are decreased significantly, and there's been no adverse events of that nature in modern studies so far. In terms of addiction, they are not inherently addictive drugs, as in when given to animals, they don't continue to push the lever and ask for more, and they build tolerance very quickly. So if you take it 2-3 days in a row, it stops working, and there's no physical withdrawal from it. And also, it's not always a pleasant experience. Some of the time, it's quite a difficult experience. It can be quite an unpleasant experience, but and so it's not a drug that people take to avoid emotion. So it's generally something that, when used therapeutically, people take to confront emotions. And there's a difference there in how the substance is used. Generally, an addictive substance is used because it avoids a problem or it avoids a difficult emotion, whereas this is used in the opposite way. And then we have the notorious bad trips. It's really important to note that these substances can cause really very difficult experiences, and they can cause experiences that can be quite traumatic when used in a way that's inappropriate, which basically means when people are not prepared, when perhaps they take a higher dose than they know or they intended to, or they don't have the appropriate support in place, they don't have the appropriate safeguards around them. Because traumatic memories can come up from the past. People can relive very traumatic experiences from the past, and if not supported, it can be re-traumatizing actually for some people. Which is why psilocybin therapy is really important in this context, rather than it just being the substance in itself, being in the therapeutic context. However, sometimes these bad trips can be prolonged anxiety or paranoia, which is caused by people going into the state and being scared by the change of state, perhaps scared that they're dying, or scared that they're going mad, or scared about the emergent memories. But support and preparation plays a huge role, and really takes down the potential of that happening a lot. And then sometimes challenging experiences in the session can actually contribute to the process. So for example, we know that in psychotherapy, people can sometimes get worse before they get better, or they can have a really difficult time working through their difficult past, but ultimately it leads to a better future. And this is also seen to be is hypothesized to be the same here, whereas people can go through these difficult experiences and this can be part of the healing process in itself. However, they're not all the same. Some of them are due to inadequate support, and some of them are just part of the process. And just briefly about how we mitigate the risk: we select people properly, careful screening of psychiatric and physical health history for people to be excluded where if they are at risk, for example, of psychosis or of heart disease. We prepare people well in terms of teaching them about the substance, what they expect. They build an alliance with the therapist as well to reduce the chance for bad trips or prolonged anxiety, prolonged fear, prolonged paranoia to happen, and to empower people to go through the difficult experiences without trying to avoid them. And then we have psychological support throughout psychological support throughout the session, which is present in either the therapist being there, or if needed, there are medications that we can give that can reduce the anxiety. However, they're really left as a last resort because, again, the idea is to go in and through the difficulties. So I'm just going to close with this quote from one of the participants in one of the studies, saying that I had an encounter with a being with a strong feeling that that was myself, telling me it's all right. I don't need to be sorry for all the things that I've done. I had an experience of tenderness towards myself. During that experience, there was a feeling of true compassion that I had never felt before. And this is the kind of thing that people can report coming out of the psilocybin experience. They report the sense of reconnectedness to themselves, a sense of love for themselves, and a sense of compassion for themselves. And this, of course, is really useful, and it's a very helpful way of interacting with oneself or with, in relating to oneself, as opposed to how people view themselves when they're in depression. People feel really disconnected. They feel a lot of anger, a lot of guilt towards themselves, and there's a real shift in this relationship, which really can be really significant for a lot of people who go through the experience. But again, it's really important to know that these studies so far are really promising, but they are not conclusive. They are small studies. They don't have a control. They are still in the starting points of moving, which is why there's larger studies going ahead right now, like the COMPASS one. And while these experiences do happen for some people, they might not happen for other people. And psilocybin may well affect people very differently, and it does affect people quite differently. So it's just important to bear that in mind, really, that we are still in the process of collecting data, collecting evidence. But hopefully, if things continue going the same way and larger trials do confirm what these smaller trials imply, then psilocybin can be a really useful tool to us as psychiatrists, and of course, more importantly, to patients. For more information about either our study specifically in Newcastle, you can go to mood-disorders.co.uk, and this will be listed below the video, I think. And then for more information about the COMPASS trial in general, you can go to compasspathways.com. Thank you very much, and I hope this was useful.